Aloha, my name is Andria Tupola. I'm the State House Representative from District 43, which starts in Ewa and ends in Maili. And today, on my show, Bringing It Back to the People, I have a special guest from University of Hawaii, Mrs. Kelley Withy. Kelley, how are you doing?
Good, thank
So why don't you give us a little background on what you do for UH and kind of what your expertise is in your field?
Great, well, I'm thrilled to be here. I'm a family doctor and I work at the medical school. And I've taken on the mission of helping to build the workforce, the health workforce in Hawaii, so that everybody has access to the care they need, where they need it, when they need it.
Nice. And the reason why I bring this up is because in Hawaii we have this huge shortage of doctors, and I feel like we listen to all these bills in the legislature about how we can cut corners because we don't have enough, but really what Kelley does is she addresses it at the root. What is the root of the problem? We don't have enough doctors, so how do we address the root? What have you guys been doing?
Well, we've been doing a lot. We're trying to grow our own healthcare providers, so the whole team. We're trying to work on the healthcare team, and so we have programs for students of all ages, including non-traditional students who want to be in healthcare, because it is the most, fastest growing field.
Right,
yes, that's
right.
what I'm trying to say. Tons of jobs.
Yep.
But kids don't always know that when they're in middle school, high school. So we try and get them into it, and we support them along the way.
Right, and I think that my concern is that, as we go through these bills and we continually see that, they're trying to get more psychologists or psychiatrists or whatever it is, that I feel like we got to still keep the highest quality of care for our people, no matter if they're in rural or they're in urban areas. And I think that the program that you guys have been doing is addressing the issue with a lack of doctors in rural areas. Can you explain that?
Sure. So I also do the physician workforce assessment, and we're short of 500 doctors right now.
Wow.
But if you look at it by island and specialty, we're actually short of 700 compared to what the U.S. mainland has on average per person. So those shortages are the biggest in primary care and on neighbor islands and in rural areas of Oahu.
Right.
So one of the fastest, cheapest, easiest ways to get people to go where you want is to give them loan repayment, because physicians, when they graduate, they owe about $200,000 at least. And so if we pay off their loans for them to work in areas of need, hopefully they'll go there, they'll love it, they'll stay there forever. That's the idea.
Well, and I think that that's the biggest hurdle for anybody trying to go to medical school, right? Is how am I going to pay off all those loans? And the day that I actually get the job, I mean, is that going to even be enough to cover what you said, $200,000 of loans that you incur from being in medical school? But yet we have this huge 700 doctor shortage in the state. So how many of those, I guess, loan repayment students or those who have applied for your program, how many of them have ended up coming to the Waianae Coast Comprehensive Health Center?
Well, we've had 25 people in our program, and 5 of them are at Waianae Comp.
Nice.
And yeah, so that's wonderful. And we find, I think 4 are now. I think 1 went into private practice or a different practice. But we have better statistics than national programs like this because we do target our own folks, and we know they want to stay here. And so oftentimes, even if they don't stay exactly where they were when they paid it back, they stay in an area of need.
Right,
So
and I think it's so important that we're not just talking about getting any doctors, we're talking about getting doctors that are invested in Hawaii, that they're people from Hawaii that have studied medicine here and want to practice medicine here. So the 5 that you did send over to Waianae Coast Comprehensive Health Center, are they of various fields, pediatrician, or what fields are they in?
They're both family, women's, and pediatrics.
Nice.
And nurse practitioners.
And so this year you guys introduced a bill, I believe it was HB916. And so can you explain to me how that bill works and why it'd be so important for your program?
So this is a loan repayment bill. We have a federal grant for $225,000 a year. They'd probably give us more if we could match more, but they require the state to provide dollar-for-dollar matching. So we haven't been able to fully utilize it because we've gone out for donations from different organizations. So HMSA, Queens, Aloha Care, UHA, Ohana, different health centers, hopefully Department of Corrections, they've all given us some funding, a little bit here and there, so we hobble it together. But it's time to rewrite that grant, and we can't hobble forever. So we're asking the legislature for $250,000 that will be used to match more than dollar for dollar, because we'll still ask those organizations for funding, but we need to keep the core program in place. And so with that, then we'll have $500,000 to give out in loans, and the loans are between $25,000 to $40,000 a year for full-time, half of that for half-time. And so we're able to have a lot of loan repairs at one time, and we'll be able to have 50 new providers with this amount of money.
So let me just clarify so that the audience knows kind of what we're talking about, is that we have a federal amount of money that's given for this program, correct? And what we're saying is that in order to have the federal program continue to run, we need state matching dollars. Is that correct?
Exactly.
And the money that you bring in from, say, these outside organizations like Queens or Kapi'olani Hospital, do those count as state dollars when they, so it does count as state dollars?
Yes.
So what they've been doing in order to kind of keep their program running is that they've been outsourcing, asking these people to help kind of, give some funds so that they can match it with federal funds. But what you're saying is that you're rewriting the grant and that you want to make sure that there's a core quantity amount of money so that you guys can continue doing loan repayment. Is that correct?
Yeah. I only bring in about $90,000 from the private fundraising a year, so that means we could only draw down $90,000 of federal dollars. So we'd only have $180,000 a year. That's what we've been working on, that or less every year. The feds would probably give us $1 million a year if we had $1 million a year to match, but of course we don't.
Yeah. And I bring that up because, I sit on the health committee, and of course I represent the Waianae area, so that's where my interest is in our conversation. But I think that when we think about some of these bills that we're putting forward that are supposed to save us money on the back end, if we allow this profession to get a license for this or that profession to do this, we might be able to solve some of these issues by addressing the core, the root of the problem, which is that we need more doctors in the field. So I think that what you guys are doing is great. And I think that moving forward, I mean, what do you guys feel about, the status of the bill and moving around? What is your gauge on?
Well, it is in it's in its final committee. It's in Ways and Means, and so that's good news. It's going to be heard tomorrow.
Okay.
Yeah, and so anybody who wants to submit testimony should do so now, so it can be heard there. Yeah, and I'm very hopeful. I mean, this is the last chance, really, because if we don't get it this year, I can't rewrite the grant, and it'll be another 4 years before the federal grant comes out.
Oh, well, we want everyone to know that it is House Bill 916. So if you are interested in submitting testimony, you can go to capital.hawaii.gov and you can look up the bill number by typing in HB916. And then from there, you can, if you're not registered on the Capitol website, get registered. And then you can submit testimony in support of the bill, especially for people that know that in rural areas, we need more doctors, we need more health care. And you want to do it the right way, which is getting local people to stay here, serve the communities, help underserved communities, and get the assistance that they need from the loan repayment program. So, Kelley, do you have anything else to add? Maybe things you're looking forward to? I know this week you're hosting a conference. Is that correct?
Yes, we're hosting a conference on developing the behavioral health workforce in Hawaii. We know we have a shortage of all behavioral health workers, including psychiatrists, psychologists, everybody, and we want to get some action steps. So on Wednesday, we're bringing together educators, industry, legislators, leaders in all the fields in behavioral health to take some action steps to get together and really make a decision on what we're going to tackle in the next year, and so that's exciting.
Well, I think it's important because we always talk about that, the homeless crisis is so tied into mental health care, but yet we've seen over the past decade a cut in services, a decrease in the amount of hours that the mental health providers are staying with patients. So I'm hoping that in your conference you guys get to talk about some of those things. Is that what you guys are looking for, input from everybody?
Yes.
And I think that when you have all of the right players in the room, I mean, maybe we can address some of those topics, because when I sit on the finance committee, I hear human services putting up money for mental health. I hear judiciary is putting up money for mental health. The public safety is putting up money for mental health. So how do you think those have been working out? I mean, do you think that those monies are being spent efficiently? How often do you guys coordinate?
Well, see, we haven't coordinated all of these folks before. They have at Department of Labor had skill panels in the past, and so we're working off of information that was gained there. The healthcare simulation model, the SIM grant that was from Medicare, State Innovation Model grant, did a lot of research and came up with recommendations. So we're actually taking all these reports of old recommendations, putting them all together and seeing which activities we can do that are shared amongst the reports and we can get done in the next year. So I'm hoping that all those pockets of money, which are probably doing good, can be brought together, the organizations can be brought together so we can do even more good.
Well, and I think what you're talking about is increasing the impact.
Yes, exactly.
Because you guys are making an impact, but if we actually are able to align these resources, we might be able to make a bigger impact.
Yes.
And I think that that's what we got to do all over the state. Is
Yes.
we got to make bigger impacts, making sure that we're not duplicating services, that we're using money efficiently. And I think I want to applaud you guys because you initiated this conference on your own. You didn't get mandated through a task force or get a bill, you know.
Well, we are part of the Health Workforce Advisory Board that the governor actually appropriated some funds to a couple years ago. Well, you guys started it, and so it's just in its infancy.
Good, good.
But yeah,
Well,
we want to know. We want action.
I still applaud you though, because I think that a lot of times people wait for some type of governmental hand to tell them what to do, when really we can do things on our own. We can actually gather with people who are interested in like-minded areas and figure out how can we take action. I think that's the big word, because we've been studying,
Yes.
we've been assessing, but you want to take
Action. We really do, and we think the time is perfect for it. And we know so many people are working on this in their little areas, but if we bring them all together, hopefully we'll get a good plan.
perfect.
Yeah.
So if more people want to get involved and know about what you're doing, how can they get a hold of you?
My email is withy@hawaii.edu. And my webpage is A for Apple, H for Henry, E for Elephant, and C for Center at hawaii.edu.
Nice.
Yes.
I want to help people to go straight to you
Yeah.
that might be watching this and getting interested and maybe getting involved, because I think the more hands, the more heads together, the better. So anything you want to add, Kelley?
I just want to thank all the people who have been testifying for the bill, because I have a great support network. They're really wonderful. And I'm hopeful that this will come to fruition and that we can do even more things. For example, we want to start a rural health coordinator at the medical school to really get our neighbor island kids. I know it's not your district, but we really need those folks to go into healthcare and to let them know about things and really be in touch with them and give them resources.
Nice. Well, we want to thank Kelley for being with us here today, and we're grateful for all the insight that she shared, and we're excited for the conference that's coming up this week. We're excited to see what happens with HB916. We wish them all the luck. We hope that some appropriation goes their way, especially in my district for Waianae Coast Comprehensive Health Center. We hope that this program, this loan repayment program, helps to bring more doctors out to the Waianae Coast and address the health needs that we have. My name is Andria Tupola. I'm the State House Representative for District 43, and this episode of Bringing It Back to You was about healthcare.